U.S. Cryotherapy, a faster recovery, better health center, introduces the first of its kind cold air therapy in the United States. However, cryotherapy treatment has become commonplace for use by the general public, medical communities, and professional sports communities in Europe, Russia, and other parts of the world. According to Costello in 2011, a relatively new modality of cryotherapy called whole body cryotherapy, WBC, is currently being offered by clinicians as an alternative to cold water immersion or ice packs. Administered through the use of a cryogenic chamber, WBC is a treatment whereby the patient is placed in a cryogenic chamber for a short duration, for no more than 3 minutes, which is comparable to ice swimming, and if used properly, will not destroy tissue. Whole body cryotherapy originated in Japan in 1980. The chamber is cooled to a temperature of minus 184 degrees Fahrenheit. The patient is protected from acute frostbite with socks, gloves, mouth, and ear protection. The patient spends a few minutes in the chamber. During treatment, the average skin temperature drops to 54 degrees Fahrenheit, while the coldest skin temperature can be 41 degrees Fahrenheit. The core body temperature remains unchanged during the treatment. However, it may drop slightly afterwards. Therapy triggers the release of endorphins, which induce analgesia, immediate pain relief. Cryotherapy is a non-medical, non-invasive procedure. This treatment can produce extreme benefits for your body, skin, and mind. The cold air therapy shocks the body while stimulating the hormones, immune and nervous systems, and leads to the circulation of oxygen and nutrient-rich blood as the body warms. The benefit is not just in the cooling phase. When in extremely cold temperatures, vessels will constrict rapidly to preserve the body's core temperature, pulling blood to the vital organs in a protective mode. When you exit the chamber, the opposite occurs as your body's skin temperature warms. You get a cold and heat effect in the same treatment. A massive opening of the vessels will enable up to 3 times greater blood flow to the tissues.
Hi everyone, my presentation today is going to be about cryotherapy, and I'm Nicole. So to outline the presentation, we're going to do background on cryotherapy, the purpose of this presentation, and then we're going to talk about musculoskeletal trauma, which is why you would use cryotherapy. And then we're going to evaluate the 2 forms of cryotherapy, whole body cryotherapy and ice bag. So the purpose of this presentation is to provide evidence-based research on physiological benefits and therapeutic benefits of cryotherapy. The 2 forms of cryotherapy that we're going to be using are whole body cryotherapy and ice bag. So what is cryotherapy? Cryotherapy comes from the Greek word cryo, meaning cold. In physiotherapy, it is used for the lowering of tissue temperature for therapeutic purposes. The application of cold modality is normally used following exercise or in the rehabilitation prescription. Most commonly, it's used for acute or chronic musculoskeletal injuries. The different forms of cryotherapy are an ice bag, whole body cryotherapy, which is the most recent form of cryotherapy, ice massage, vapor coolant spray, and contrast baths. Musculoskeletal trauma. So this is just explaining what musculoskeletal trauma is. Macro trauma which means large magnitude injury to the musculoskeletal tissues, may occur from moderate to severe sprains or strains. A micro trauma, which means small magnitude injury to the musculoskeletal tissues, may occur from a stress fracture or overuse injury. The mechanisms of trauma include physical, chemical, thermal, metabolic, and biological. And then due to these different forms of trauma, and an inflammatory response may occur. So the first thing to occur is primary injury. So trauma from the aforementioned mechanisms causes damages to the cell membrane and structural components of the cell. Disruption interrupts the homeostasis of the cell, potentially leading to necrosis. This immediate effect is called primary injury. During primary injury, skeletal muscle, vascular connective, and nerve tissues are affected all at the same time. Primary injury leads to the secondary injury. in the remaining uninjured cells. The secondary injury occurs on the peripheral region of the cell's primary lesion. So there's two types of secondary injury: secondary enzymatic injury and secondary hypoxic injury. Secondary enzymatic injury is where enzymes are released from the lysosomes of immune cells. Due to the changes in the cell structure, the membrane's phospholipids lose polarity. The loss of membrane polarity reduces the fluidity and integrity, leading to excessive swelling within the cell. The excessive swelling could eventually lead to cellular death and necrosis. So next is secondary hypoxic injury. So the physiological effects that happen due to secondary hypoxic injury include hemorrhaging from damaged blood vessels, hemostasis from the clotting cascade, reduced blood flow, and increased extravascular pressure. So when the reduced blood flow occurs, this is from the inflammation-induced increase in blood viscosity, and that's what causes ischemia to occur due to the increased extravascular pressure from a hematoma or muscle spasm leading to the hypoxic period. When ischemia is occurring, the mitochondria do not have oxygen available to serve as the terminal receptor for electrons in the oxidative phosphorylation pathway. The hypoxic period causes a metabolic imbalance that leads to oncosis, acidosis, and lysosomal digestion. When hypoxia is occurring, oxygen is not able to be used in the oxidative phosphorylation, so this leads to a dependence on the glycolytic pathway for ATP production. But the glycolytic pathway can only provide energy production for a limited period of time. So once the glycolytic pathway cannot provide the sufficient ATP, the homeostatic mechanisms fail, which then leads to the oncosis and cell death and possibly necrosis. So in order to reduce the effects of secondary injury, that is when cryotherapy is indicated for therapeutic benefits. So indications are why we use cryotherapy. So cryotherapy is used for acute pain, chronic pain, acute swelling, myofascial trigger points, muscle guarding, muscle spasm, acute muscle strain or sprain, contusions, tenosynovitis, tendinitis, and then they can also be used for DOMS. And in this picture, it's just showing a ligament that's been torn, actually a couple ligaments that have been torn due to injury, and this is when you would use cryotherapy. So before using cryotherapy, you always have to ask your patient if there's any contraindications, which is reasons why you wouldn't use cryotherapy on them due to the fact that it could cause harm to the individual. So some of the contraindications are impaired circulation, which is called Raynaud's phenomenon, peripheral vascular disease, cold hypersensitivity, open wounds or skin conditions, and then infections. So the physiological effects that are associated with cryotherapy and what it does for us. So it lowers the temperature of the injured area, which just lowers the metabolic rate. The analgesic effect, which just means that it reduces pain, but it does this by decreasing nerve conduction velocity. Promotes vasoconstriction, which helps with hemorrhaging and the swelling, or edema, which is also means swelling. Decreases phagocytes and nutrients to the injured area. Decreases blood flow. Decreases lymphatic drainage and venous drainage. And then decreases muscle excitability and muscle spindle depolarization. So, just a little background on each of the cryotherapy techniques. So the first one is cold ice pack. This technique has been used since the 17th century. It is the most commonly used just due to the fact that it's easy and it's not as expensive as the other cryotherapy techniques. The duration that you leave it on for is 20 minutes, and there's 4 stages of sensation that is felt by the individual when they're using this form of cryotherapy. The first form of sensation is uncomfortable sensation of cold, followed by stinging. Then they have a burning, achy feeling, and lastly, numbness. Whole body cryotherapy is the most recent form of cryotherapy. It was introduced 30 years ago for treating rheumatic diseases. It's performed in a temperature-controlled chamber that is usually at temperatures of negative 110 degrees Celsius to negative 140 degrees Celsius. The duration of the treatment time is usually 2 to 3 minutes due to the extreme cold. It's used to relieve pain and inflammation. It decreases muscular enzymes that are associated with muscle damage. And in the sports medicine realm, it's specifically used for overuse syndrome and recovery between training sessions. However, due to the fact that this cryotherapy is new, there's lots of controversy about it. So the first literature review study that I looked at is involving whole body cryotherapy. The background is just a little background. Endurance runners obviously must have extensive physical and psychological involvement during training and competition. But in order to achieve this, the muscle recovery must occur. So what these researchers wanted to do was to see the effects of 3 different modalities, which included whole body cryotherapy, far infrared, and then passive modalities, which one would hasten muscle recovery within 48 hours following a simulated trail race. So how they did this was they had 9 well-trained runners perform 3 reps of a simulated trail run. The simulated trail run induced the muscle damage. They hypothesized that whole body cryotherapy would be beneficial in hastening the muscle recovery between the 3 modalities. The results were maximal voluntary contractions and perceived sensations were recovered 1 hour after whole body cryotherapy, and the most beneficial effects were 48 hours after whole body cryotherapy was used. With the far infrared, there was no recovery seen until 24 hours after the application. And with the passive modality, no recovery was seen at all. So this just basically is explaining that whole body cryotherapy is beneficial in muscle recovery following endurance running. So the second study was done about assessing the influence of whole body cryotherapy on aerobic and anaerobic capacities. So they hypothesized that whole body cryostimulation would improve physical capacity. They used 30 subjects which performed 2 ergocycle trials before and after 10 sessions of whole body cryotherapy. They assessed aerobic capacity by using a progressive cycle ergometer, and they assessed anaerobic capacity by a 22-second Wingate test. The results of this study were 10 sessions of whole body cryotherapy increased anaerobic power. No change was observed for aerobic capacity, and what they concluded was that the whole body cryotherapy could be implemented into a training realm for just anaerobic metabolism. And what they also saw during this study was there was an increase in anaerobic power, but it mostly occurred in the male subjects. There was an increase in peak power and total power, but there was also a decrease in time to reach the peak power. And then males and females increased post-exercise plasma lactate concentration following the whole body cryotherapy. So the third literature review is about ice bag studies. And a little bit of background on this was, so there's a concern regarding the functional performance when returning an athlete to play following the application of an ice bag. And this is due to the physiological effects. So an ice bag reduces the intermuscular temperature. And they were wondering if, due to the fact that it decreases the intermuscular temperature and the intermuscular temperature continues to decrease after the removal of the ice bag, if this would leave the athlete prone to injury. And this was due to decreased nerve conduction velocity, sensitivity of the muscle spindles, and decreases the muscle's ability to generate force following an ice bag application. So this study researched the functional performance of the hamstrings following a 3-minute and a 10-minute ice bag application. And the functional performance consisted of a shuttle run time, a co-contraction time, and a single leg vertical jump. They hypothesized that application at both time intervals would have a negative effect on functional performance. The results concluded that athletes' functional performance is impaired immediately after 10 minutes of cryotherapy and for 20 minutes following the removal of the cryotherapy application. They also included that there was no effect after the 3-minute application, but this was due to the time limit and that it was just superficial cooling and not the actual decrease in intermuscular temperature. So it is not beneficial to return your athlete to play following an ice bag application. You can actually injure the athlete. The next study was done about assessing 2 cryotherapy techniques, cold water immersion and crushed ice bags. Cold water immersion reduces nerve conduction velocity. That's one of the physiological effects. Both techniques reduce intermuscular temperature, and intermuscular temperature continues to decrease with cold water immersion. However, it does not, from what this study said, decrease intermuscular temperature following the application of an ice bag. Also, a little more background is crushed ice bag. It decreases the intermuscular temperature to 7 to 8 degrees Celsius, while the cold water immersion decreases it to 5 degrees Celsius. So the study was done on the length of time it would take each modality to decrease the intermuscular temperature below 8 degrees Celsius. They also wanted to look at, between the cold water immersion and the crushed ice bag, which modality will continue to decrease intermuscular temperature 90 minutes post cryotherapy removal. And then they also wanted to assess the relationship between adipose thickness and decrease in tissue temperature. So the results, there was no significant difference between modalities in length of time to reduce intermuscular temperature to 8 degrees Celsius. Intermuscular temperature remained decreased 90 minutes post-application with cold water immersion. But there was no direct correlation with adipose thickness and reduction in intermuscular temperature. However, the researchers wanted to state that in all the other studies that they looked at, the reduction in intermuscular temperature did depend on how much adipose tissue was apparent, or on the adipose thickness, I should say. The 6th literature review that I looked at was on the background of ice-to-go. So basically what ice-to-go is your athlete comes in following practice and they want ice on an individual body part. They take the ice and they leave the athletic training room and go to class or wherever they need to be. And what these researchers wanted to look at was, does it negatively affect the therapeutic benefits associated with ice when you apply it and then they walk out and they're walking? Is it actually performing what it's supposed to do? So the purpose of their study was to determine the length of time needed to decrease the intermuscular temperature of the gastroc while walking, followed by rest. So a little bit of background. There was 9 healthy, physically active males and females which experienced 3 different treatment conditions on separate days. So one of the treatment conditions was rest. Then the other treatment condition was walk for 15 minutes followed by rest, and the 3rd treatment condition was walk for 30 minutes followed by rest. During each treatment, participants wore a 1 kilogram ice bag secured to the gastroc. The results of this study, so the most therapeutic benefits from cryotherapy occur when a patient was at rest. However, if it is necessary for your athlete to leave the athletic training room or wherever with ice, that you should leave the ice on 20 minutes post, when you start to rest, following a bout of walking. So the conclusion is literature supports the use of both cryotherapy techniques. Both cryotherapy techniques have therapeutic and physiological benefits. With whole body cryotherapy in particular, it improves recovery from endurance exercise immediately in 48 hours following training. It also aids in improving anaerobic metabolism. And with crushed ice bags, it's the most practical form of cryotherapy, is the easiest, cheapest. The literature does not support returning an athlete to competition practice, etc., following the removal of an ice bag. However, it does support the use of it for therapeutic benefits and physiological benefits. So, what practical applications? So obviously I'm an athletic trainer, as we've heard in class. Cryotherapy is used regularly in the profession of athletic training, post-injury, or also in the rehabilitation setting. And so as a professional athletic trainer, one of the first things I recommend following an injury, or if a patient is just sore, is just to ice after an acute injury. And all of my patients have responded well to the application of therapy to reduce vasoconstriction, pain, etc. Although I've not personally used whole body cryotherapy because it's rather expensive, and that wouldn't be something that would come up here anytime soon, after reviewing the literature surrounding its use, I do believe that it's beneficial for recovery and for improving exercise. That is it. It's following my presentation. Here are my references.